topic allotted to me was actually the anatomy and with regard to cosmetic gynecology. So we have been listening, and Dr. Pooja Sharma also covered a part of it, that anatomy. But according to me, this anatomy and this cosmetic gynecology is nothing new. We are discussing that this is something new. We have come up with a futuristic branch, this cosmetic gynecology, blah, blah, blah. But actually, this is an age-old practice. And we would be discussing over here the anatomy, the private parts of a female, the most beautiful part, the procurement, which actually takes care of and takes in account the procurement, the regenerative part and reproductive part, everything is there. But yes, it has been, the femininity has been celebrated since long. It has been in our Vedas, in our Shastras, and in so many like mythological pictures are there, literature is there, cosmetic gynecology is everywhere. So my part of my lecture would be covering the anatomy part and also a bit of those mythological aspects. So clinical anatomy of the female external genitalia relevant to the practice of cosmetic gynecology. We all know the external genitalia starts from the mons pubis anteriorly and posteriorly till the anus. Sometimes the beautiful buttocks also come into those parts. I'm not going to enumerate everything. This is the basic of cosmetic gynecology. So, and here also it has been compared the male genitalia, the external genitalia, and the female external genitalia. What are the similarities? What are the organs which are actually equal to, like penis and the clitoris, the scrotum, the labia majora, and many more are there. So we were discussing that this is the fastest growing subspecialty of gynecology. These days, we are discussing regarding that, but according to me, this is an age-old practice. I have always been giving the example of episiotomy we are giving to the perineum. We are actually safeguarding the perineum. We are actually maintaining the beauty of the bottom. So this cosmetic gynecology is an age-old practice we would be seeing here. The most scandalous painting of the 19th century, the Gustave Courbet, made a painting showing the external genitalia of a female, part of her belly and part of her one breast. This came in 19th century. And this was the most scandalous painting. Everywhere, like revolts were there, things like many were opposing, what is this? What sort of things are coming into the society? Like we are not, many were there who were not accepting and many were there who welcomed. And this painting has become the benchmark in our, the modern practice of cosmetic gynecology. Here we are seeing the mons. The mons pubis, one is protruding, one is flattened, which is beautiful according to you. This is absolutely subjective. We cannot say that this is beautiful and this is not. So this is the lesson. In cosmetic gynecology, we are not going to standardize things according to a selective person. Like this should be the presentation of the female genitalia. One who is satisfied with it is okay. If she is having some sort of functional problem, she is contacting you. Many times a female is having absolutely everything is normal. Normal labia, normal mons, normal appearance, and yet she is asking just because of those pornography and many things like pictures are there, availability of everything on internet. She's comparing everything. So our duty as a cosmetic gynecologist is not only the correction of reconstructive surgeries, corrections, bleaches, and many more things we are offering to the patients, we have to counsel them also. So can anybody say that this one is good, one is flattened, that is going to harm during her, once she is intimate with her husband, she is not comfortable because her mons is absolutely fat. It is just rubbing, her bones are actually paining while the copulation. And that the protruding mons is absolutely protruding all the time. From the clothings also, it is visible. So she's not happy. This is the relationship of a mons with the pelvic girdle, the pubic bone, and absolutely the satisfaction of the patient. So components of the vulvar complex is these labia majora, inside them labia minora, the vestibule, the clitoris. Anyone can be happy with whatever she is having. But yes, trends are there. Now, females are coming to the doctors and they are asking for something beautiful. The supple labia majora and those which are absolutely covering the labia minora, which should not be visible while regular exercises of daily routine. Here also, another depiction. One is happy with what she is having, and one is getting it corrected, and what she gets after the correction, the reconstructive surgery, now she is happier. What we do labiaplasty. We offer. We just tell those patients, this is the normal anatomy. Whatever you are having is a normal one, but yes, you can change it if you want. That those, like I'm telling you the example of one of my patients. Many of you, we are gynecologists and we are dealing, every day we are dealing with such patients. A patient was having hanging labia minora, two stuff. One is lifting from here, one is stretching from here, and then I could do the evacuation. And once she was out of her general anesthesia, I just asked, how are you maintaining your marital life? And then she started weeping. Every day I'm getting scolded. Every day I'm not happy with this, but what should I do? Then I told her, you can get it chopped off. You can get it reconstructed. So this is something. One more, we have been discussing regarding this. Anish Kapoor, the biggest name. He's the sculptor from London, the Indian origin person in London. He made this tunnel, this copper tunnel, and gave the name Dirty Corner. This also got scandalous. In 2011 to 2015, this was something which was discussed in a majority of, like many were there again. It was same as Gustav's painting. Here also, this is depicting the internal genitalia of a female. And this was something, the vagina of the queen, he gave the name, this dirty corner. This was also a book, and it is there. So cosmetology, cosmetic gynecology, one who is thinking that this is better and this is not, this is beautiful, the queen has got the best vagina, is being depicted over here. Here again, the goddess which is having the beautiful vagina, the painting is there. This is goddess of Yoni is there. She is having a beautiful labia minora, clitoris, which has been actually beautified with many things, but yet a female comes and says that this, I want to get a better one, a bit chopped off, a different type of. So we offer, even though she is a goddess of Yoni, but we have to offer whatever she wants if it is in the limits of what should be offered. Like, so different type of labia minora are there. The butterfly one, the one which is asymmetrical, the one which is long but symmetrical one, many varieties are there. Anatomically, we have given the Motakef classification. The Motakef classification is the class 1, which says that the width of whatever is coming out of, which is visible, should be between 0 to 2 centimeters. Class 2 is 2 to 4 centimeters, and class 3 is more than 4 centimeters. This standardization was just so that it should be universally accepted. Every patient from all over the world should be treated in a proper way, in a standardized way. Another classification is Banwell classification, which says type 1 is the upper third prominence, type 2 is middle third prominence, and type 3 is lower third prominence. So I'm going back again. It is here, the Banwell type 1, the upper third prominence. Banwell type 1 and 2 both is here, and here the asymmetrical one. Motakef more than or between Motakef 2, between 2 to 4 centimeters, the other one is between 0 to 2 centimeters. So these classifications are combined also. Again, yoni, the vagina has always been worshipped in our literature, in our shastras, in our Vedas. We get pictures, we get literature which is saying that it has always been worshipped. Now we are coming to the clitoris. Clitoris, the female representation of male penis. And it is not something visible, the button part of the protruding part, which is glans. It has got a huge structure. And it has been said that all orgasms are clitoral orgasms. Orgasms are clitoral as well as vaginal, but it has also been claimed that vaginal orgasms are also clitoral ones because the clitoral crura is just under the superficial perineal muscles. So the bulbospongiosus and bulbocavernosus. So the crura is just below the bulbocavernosus, and that is why the stimulations and everything is going indirectly to the clitoris again. So all orgasms are clitoral orgasms. Different types of labia as well as the clitoral anatomy has been depicted over here. As I said, Motakef's and Banwell classification, the upper third prominence, continuous with the clitoris. The clitoris can be the double one, the single one, the covered one, with ryuge or with layers. See here, the last one, the F1. The pictures have been taken from Dr. Red Ellen Sood, the god of this cosmetic gynecology, claimed. And yes, he has given beautiful pictures. Yeah, I'm just winding it up. Again, here are different, so we can think, there are different types of beliefs also. One is known as Odhunga Matanji. It is in African countries where the labial elongation is done. It is there in their rituals. From the very beginning, the girls are given those stretchings for their labial elongation. So long hanging labia are something which are known as the part of the beauty of their private parts. So it can be different. Globally, everything is acceptable whatsoever there. So nervous system, innervation of external genitalia, nerves are there. We all know this. Blood supply for clitoris, labial arteries, bulb, and for inferior rectal arteries there. In our literature also. Here also, the pulling of moon. This picture is in our mythology. The pulling of moon is there. One is pulling the vagina downwards, saying that, yes, I am bringing the heaven to the earth. Types of FGM also should be taken care of because in the world, we, even in India, a few cities inside the interior parts of southern part of India, there is FGM, and FGM is first one, no FGM. Second is type 1, where clitoris is chopped off. Second, the type 2 is the internal, the labia minora has also been chopped off. Type 4, type 3 is there where everything has been stitched up. These are the pictures, and this is a shame actually. And here comes the literal role of cosmetic reconstructive surgeries. The vaginal monologues. The Eve Ensler has written a book. So things have been discussed since long. Things are there. We think that females are not opened up, they are not discussing their problems, but yes, they are there. Literatures are there, and many pictures are there. Artist Anish Kapoor has given this picture. This shows the splitting of London, the UK. The nation has been split into two parts, and the depiction is just like this. Anish Kapoor is the artist one, the sculptor one, and his perspective is entirely different, but he sees the beautiful internal parts of a female everywhere, wherever he can put. He just depicts fearlessly.
Dr. Poonam, we have to conclude the...
Yeah. I'm just winding it up. These are our the urogenital system, the diaphragm, muscles. Yes, I'm not different. Megumi Igarashi, I would take the name. This Japanese lady is making many cartoons, many literatures, giving lectures regarding genitalia, especially vagina. Nobody talks about that. And I would not leave the dais without discussing this Sheila Nagig. These are the sculptures, these are the presentations in Spain and in the Western countries, many where they are found. These are known as Sheila Nagig, and they are extravagantly showing their vagina. They are there on the walls everywhere in those countries, and they are known as the goddess of femininity. They bring wealth, they bring life, they bring pleasure to the world. And they are being worshipped. And in India also, their counterpart, Lajja Gauri, is there. This sculpture is from Alampur, India. Here also, this is also a part of this Sheila Nagig. Hymen, I'm not wasting the time. Virgin Mary, depiction. Since long we are worshipping this, the vaginal part. So sexy you are. G-spot should not be forgotten before closing the lecture. G-spot, the deeper A spot is also there, the erogenous spot inside the vagina. Breasts, the vulval mythology is there. Vulva is being worshipped. The bobo. It is the depiction of the vulva. The tummy is having the face, and the pubic area is worshipped. Dear woman, you are an embodiment of divine celebration. More power to you. Thank you.